The things we would never do as dermatologists, part 2. What's up, everyone? We're back. I'm Dr. Shah.
Dr. Maxfield.
And welcome back to our channel, Doctorly, where we talk about all things skincare and dermatology. And in this video, we're going to be going over the next things that we would never do as dermatologists. There are so many things that come in the office, the side effects of the things that people are doing online, the mistakes that we've made that we've integrated into this video. So hopefully you find this series helpful. The things we would not do as dermatologists, here we go.
Here we go.
First up, exfoliation of your lips. Let's think about the lips from a biological perspective, right? So when you have the rest of your skin and you take a biopsy of the skin, which we do all the time, or if you do Mohs surgery, you see this even more frequently in the office. But when we take biopsies of the skin and you look at it, you basically see the multiple layers of the skin. And at the very top layer, that top layer of the skin that causes that dullness that you want to exfoliate away, this is the layer that also blocks your pores and causes acne, is that stratum corneum layer of the skin. These are your corneocytes. They're basically dead skin cells that have no nucleus. And these are the areas that we really want to exfoliate away. Now, if you do a deeper chemical peel, it will also get rid of some of the deeper layers of the skin by breaking apart those keratinocytes. But the lips do not have a stratum corneum layer of the skin. They lack hydration as a result of that, which is why your lips get more dry than any part of your body when you take Accutane, because they don't do a good job keeping moisture in, because they lack the stratum corneum layer that you are exfoliating normally when you exfoliate other parts of the skin.
Yes, exactly. So I am a Mohs surgeon, fellowship trained, and one of the things I do is I treat aggressive skin cancers on the lips. The procedure and repair that I typically will do is called a mucosal advancement flap, and it's actually probably too graphic to actually show you. But what I do is I'll take the wet part of the lip here and I will free it up surgically, move it forward to replace usually the majority of the lip that's been taken surgically. And what you'll see microscopically is that the wet part of the lip really has no stratum corneum, and over time, in a reaction to the insults of the environment, it actually undergoes metaplasia to become more resistant. And here's how that plays in with exfoliation. So just like the environmental stressors, the dryness, etc., for the lip can change it over time, if you aggressively exfoliate, whether physically, mechanically, which is physical, whether physically or chemically, you might actually cause something like a callus. You can actually probably induce this part of your lip that's already trying to survive in the environment to undergo further thickening, kind of like a callus, and you might actually get more texture over time, as well as make it more vulnerable. And if you thought you were addicted to chapstick before, you may become even more addicted now because you're trying to compensate for this lip that just cannot hold water to save its life.
Yeah, your body does a great job responding to stressors, which is why when you lift weights or you lift anything heavy or you have any abrasive job on your hands, you'll notice that calluses form. Those are thicker layers of skin that your body is reacting to the additional stressors. So if you start exfoliating your lips aggressively and frequently, what you'll notice is that your lips actually start to require thickness in order to try to protect itself, essentially. So your lips will start to actually become more thicker, less softer over time if you continue to do this. Now, if you exfoliate your lips once or twice, probably you're going to be okay. But if you start to get this into your routine regularly, it does put you at risk for changing the quality of your lip texture. And most people just need moisture to soften their lips. They don't need to be exfoliating regularly. We don't recommend it.
Exactly. So if you are intent on it, because we do get the comment like, I use lip balm, but my lips are still flaky. At best, an exceptional exfoliator to remove the skin cells will help. But the key foundational thing that you need to do is add moisture. So it's not exfoliate to solve the problem, it's moisturize to solve the problem, and perhaps a rare exfoliation to give you a head start to get you back to like a clean slate or baseline.
Next up, we would never pop a pimple that's not a whitehead. What does that mean? And we would also specifically not pop pimples within this triangle of death or T-zone. So when you have a pimple that's not ready to come out, meaning that you don't see the pus, if you try to pop that, only bad things will happen.
Yeah, exactly. And this is something people do all the time. It's very common, I guess, especially as you're first experiencing pimples. You have a pimple, I need to pop it. If it does not come to a head, if it is deeper in the skin, and you can even see histologically here, like pimples can start deeper into the skin. And if they're not at the surface and you end up pushing it, sure, let's say in theory you pop it, but you just popped it underneath the skin. It's like a volcano that erupted downwards, and you're forcing all of that bacteria and inflammation into the substance of your skin. And this will not only make a big scar down the road, but acutely it can cause infections, cause the pimple to become larger, more irritated, deeper, and last longer as well. So it will actually work against clearing it up faster. It will make it stick around much longer.
Right, and it can cause cellulitis, which is inflammation or infection of the tissue. It can cause an abscess to form, because when you have your pimple, they're mostly contained to your pore. And that pore is actually keeping it from going to other parts of the body. If you pop it and it explodes outward, it's gonna cause a lot of problems in deeper layers of your skin. It damages your collagen and elastin. That's how you get those deeper acne scars. So if you are going to pop a pimple, which we don't always recommend just in general, you wanna be able to see that whitehead because then it has a clear path for it to get out of the skin. And finally, if you're gonna pop a pimple, do not pop a pimple in this T-zone because this area, even though there are valves, we used to think this was a valveless system, there are valves. The direct connection between this and the cavernous sinus and other areas of the brain can lead to infections that do spread to the brain. We see it rarely, it's happened, it's been reported. Just be careful in that area.
So next up, this is something we see, I'd say in the office a lot. So I actually think more of you need to hear this than maybe any other thing we've talked about to date. And that is using a heating pad for a prolonged period of time. Rarely this can be associated with like laptops on the lap, but basically some form of heat on your skin for a long time.
Yeah, it's a great feeling. It's almost like an addicting feeling. I remember from a childhood, we used to get these like, I don't know what color you would call maroon water bottles that we would put like they were like rubber, and I even remember the way that they smell, and we would put them on areas of pain, muscle pain. We used to be athletes when we were younger, and so we would always be using these heating things, and then we would use heating pads all the time, and then I would always use my laptop on my legs. And you can get something called erythema ab igni, which is this mottled reticular redness that occurs, but then can also form hyperpigmentation that sticks around for a long time and even increases your risk of squamous cell carcinoma. So you can actually get skin cancer from this reaction. And so if you start to notice this mottled reaction anywhere where you're putting heat, it's as a result of that heat, and you should stop that immediately.
Yep, and it can become scarred down, contracted. It can be a permanent change. Like nothing can treat this once it's occurred. And really what's happening is you have this not subclinical heat because you appreciate it, but it's causing subclinical damage. So it's warm enough that you feel it, but the damage isn't bad enough that you can appreciate it. And so over a prolonged period of time, you get these structural damages and changes in the skin that again become irreversible. So you really need to be judicious. And there's no set amount of time. I can't tell you to use a heating pad for 5 minutes, 10 minutes, and you're good, but don't use it every single day. Use it for an acute time, for a short period of time until like the issue resolves. If you have chronic back pain or something, unfortunately, this is not a long-term solution for you.
Next up, if you ever come to my house, remove your shoes immediately, okay? No shoes in the house, no barefoot in the locker room, and I'll tell you why. So first of all, they've done studies on this, okay? People who wear shoes in the house, and even the bottom of your shoes, the amount of feces, the amount of fungus, the amount of bacteria that people who wear shoes in the house bring into their house is unquantifiable, okay? And when people come to my house, I actually have little footy booties that I keep outside of the door so that people can actually put those on if they're gonna keep their shoes on. But I prefer that most people remove their shoes, but if they don't, I even have booties for them. And the reason why is I do not wanna get a nail fungus. I do not wanna get onychomycosis because they're very difficult to treat. Sometimes they permanently damage your nail, and the treatments are sometimes worse than the disease.
Yeah, so similarly, in the locker room at gyms, this is just a classic way to get exposed to this fungus. It's warm, it's humid, you got a million feet walking around that locker room, and inevitably it will spread to you. And once again, it's under your nails. That's what I'm most afraid of. Yes, it can get on your nails. Yes, it can get on your skin. I'm much more concerned about the nail part because this also can become permanent. Treatment can be extremely difficult with low cure rates no matter what you do. So protect yourself from the environment that includes your feet, whether at home or in public.
Absolutely. Now, there are oral medications that can treat this onychomycosis, also known as a tinea infection or a fungal infection of the nail plate, but a lot of them can be rough on the liver, so you really only want to use it when they get really bad. So you just want to prevent this if there's any way that you can. We do have a whole video on how Vicks Vapor Rub can help in this scenario and all the science behind that, but try to avoid it if you can, and just don't allow people to bring shoes into your house if possible. In some parts of the world, it is taboo to do this, but in other parts of the world, people do wear shoes in their house and even bring shoes on their bed, which I think is ludicrous.
So the last one here then, something I'm guilty of myself, is not using a clean towel. And just so you know, there's no judgment from me to you. As we do these lists, these are all things that I have done historically. There are still things I do now that I need to improve upon and change, and we'll get to those as well in the future. But having a dirty towel, they harbor bacteria and they stink, and then you stink. How often do you change your towels?
So pretty frequently now, but that's because I'm married. Before I got married, I probably would change my towels like once a month, best case case scenario, which is pretty disgusting. Now we change our towels probably twice a week. And I would say at least once a week you want to change the towels. But what I have found, and I actually was very resistant to this fact at first, was these Clean Skin Club towels. When you first told me about these, I was pretty resistant to this concept of using a paper towel on your face, which is how I perceived this. And the more practical this has become for me, as somebody who just has to do so many loads of laundry for a new daughter, I don't have time to be washing my towels all the time and being worried about this. Having a clean towel on your countertop in a box that's soft, that's much softer than a regular paper towel. Now, there is a waste that occurs here, right? And that's one of the things that I don't like about these paper towels is that it is wasteful in some ways. Even if they're biodegradable, there's a waste that's occurring if you're using a single-use towel. However, the practicality and the fact that I'm using a new clean towel every single time when I wash my face, and all of our towels are white. So for example, if my wife is wearing makeup or I'm using a tinted sunscreen, sometimes those white towels, whatever you're using in their face, it doesn't wash off completely when you're washing your face, and then they end up on that towel. It is kind of nice to get to, one, use a clean towel every time, and two, make sure you're not damaging your towels from whatever else is on your face. So using a clean towel and throwing it away, there is some practicality to this that for some reason has become like a guilty pleasure of mine.
It is. It's like it is a guilty pleasure, but it's also like a practice. I think we use this word all the time when we talk about this brand. I mean, they're here. They're here also, like, this is not staged. They just happen to be here because they find their way. Oops, sorry, microphone flips.
Yeah, because when we shoot these videos, we apply products to our hands and face, and so I just used one.
Yeah, exactly. There's something very practical about them. Again, not poo-pooing the idea that they are wasteful, but they go so far as I think is reasonably possible to minimize waste and to support the environment in some way by being biodegradable, sourced from bamboo or other things like that. So yeah, it would be an improvement on your life and your skin barrier if you do a good job with hygiene. Optimally clean your towel very regular. I think twice a week is optimal. Once a week is acceptable. That's about the cadence I've got mine at, which is a huge improvement. And then also for daily life, if you opt for something like a Clean Skin Club towel, I get it. It's very practical. It is actually very helpful.
Right. Now, you could say, well, you know what? I'm not going to do that. I'm a much better planner than you are, and I'm much more organized than you are, and good for you. What you could do is you could just get 5 hand towels or washcloths, or 7 of them, and you could just put them on your counter every week. You could leave them there. You could use them one by one, and then you could wash again once a week. So if you did have the foresight to do that, then you don't need an individual towel. But if you're like me and you have no foresight, then this is a really good option for you. We'll see if we can get you a discount. They're sold on Amazon, so I don't know if we can, but if we can, we'll put a link below for you. But I have found those helpful for people who have trouble with that. Now, if you don't wash your towels, risks of acne. One of the things that I've noticed personally is styes. I'm like very prone to styes. So if I don't use clean towels, it makes a big difference to me. And also for somebody who doesn't use clean makeup brushes or clean mascara rollers or spoolies, that's also super, or a blender, egg or whatever, those increase your risk of bacterial infections of the eyelid margin, also known as styes. So just wash your things regularly. Anything that you're applying to the face, make sure that you clean your phone with a alcohol wipe every now and then, just to remove anything that's harboring there that can introduce bacteria onto the skin or onto the eyelid margin.
Yeah. All right. So there is a list of things we would never do as dermatologists. We hope this is helpful. And if you have a list of things that you refuse to do just to promote your health, skin health, anything, let us know. Would love to see those. Love to talk about those, reflect on those, maybe implement them ourselves. Please leave those in the comments, and we will see you next time.
We'll see you next time.